Introducing the Caspian Spinal System, featuring Mini Mesa from K2M, Complex Spine Innovations. The patient's position is always up to the discretion of the surgeon, but most commonly, patients will be positioned prone. A standard midline exposure of the cervical and/or thoracic spine portion that is to be fused is then performed. Hooks are typically placed caudal. However, in some instances, they may be placed cranial. The implant may be inserted with the hook holder. The desired entry point of the pedicle is chosen and then perforated with an awl to expose the underlying cancellous bone. The entry point is then cannulated with the small pedicle probe. Prior to drilling the pilot hole, determine whether the fixed drill guide or adjustable drill guide will be used. Fixed and adjustable drills are available in both 2.3 and 2.8 mm diameters. These diameters are equivalent to the minor diameters of the 3.5 and 4.0 mm screws, respectively. Fixed drills are available in 12 mm, 14 mm, and 16 mm lengths, and are color-coded by length and diameter. Check pedicle wall soundness with the ball tip probe. Taps are available for both the 3.5 and 4.0 mm diameter screws and are undersized 0.5 mm relative to the major diameters of the screws. Slide the tap sleeve slit side first over the threaded portion. During tapping, as the tap penetrates, the tap sleeve will begin to slide up the tap, displaying the current depth. Use the depth gauge to determine pilot hole depth and correlating screw length. After the pedicle screw pathway has been prepared and proper screw size has been determined, load the implant for screw insertion using one of the Mini Mesa screw inserters. It is important to grasp the implant by the screw shaft and give a slight rotation while simultaneously applying a downward force to properly engage the screw. Once loaded, spin the knob located above the sleeve clockwise to lock screw in place. Once the Mini Mesa screw has been loaded, insert the screw into the pilot hole until desired depth is reached. Disengage the screw inserter by turning the knob above the sleeve counterclockwise. Once the appropriate screw has been inserted, the housing of the screw can be adjusted with the Mini Mesa head adjuster if necessary. The appropriate rod size may be determined utilizing the rod template. If it is necessary to cut the rod, the ratcheting rod cutter may be used. The final cut rod will measure 3.5 mm longer than the visible length of the rod from the flat surface to the end of the rod. The rod bender may be used to contour the rods to the desired amount of lordosis or kyphosis. Once the rod is bent to the desired contour, insert the rod into the Mini Mesa screw heads using the rod holder or rod holding forceps. In instances where a translational or reduction force needs to be applied to the rod, the left or right torsional rod reducer may be utilized. The Mini Mesa system offers a number of ways to introduce and reduce the rod. For quick and simple rod introduction techniques, the quick unlocker may be employed and has the ability to introduce the rod up to 2 mm. For reductions up to 10 millimeters in mini mesa screws, the mini crickets may be utilized. When using the mini crickets, you can also achieve partial locking with the mini superfly. The mini mesa locker is then used to final lock the mini mesa screws utilizing zero torque technology. Grasp the center shaft of the mini mesa locker and engage the distal end onto the mini mesa screw. Ensure the shaft of the instrument is collinear with the implant. A gently axial tug can be performed to confirm docking. Squeeze the handle to fully lock the mini mesa screw. When fully locked, the mini mesa screws allow for no profile above the rod. The quick unlocker may be used if unlocking is necessary from partial or full lock. Engage the distal portion of the instrument into the detents of the screw housing and fully squeeze the lever. Once the screw is in the unlocked position, the rod may be extracted from the implant housing using the Rod Puller Plus. If screw height or screw removal is necessary, the screw height adjuster may be used. Make sure the screw head is collinear with the shaft and insert the screw height adjuster into the driving feature of the screw head. Rotate counterclockwise to remove. The Caspian Spinal System featuring Mini Mesa from K2M. Complex Spine Innovations.